cards on the overhead on this? Okay. Okay, how many of you have had surgery of some sort? Okay. Did you perform that surgery on yourself? Like, no? Okay, I guess not. So, my topic is self-surgery, which is when you go into yourself and you do the surgery yourself, you cut yourself open and you go inside and you fix whatever's wrong with you. Like, technically this can also apply to, say, yanking out a tooth or draining a boil, which are things that some people do at home. But for this, I'll only be referring to the kinds of surgery that we usually think of as surgery, such as appendectomies and other things where you cut yourself open and go inside. It's also quite common for self-surgeries to take place in people who are mentally ill, but I won't be referring to those either. I've been interested in self-surgery and things like that for quite a while now. I think it's pretty fascinating why somebody would cut themselves open to do something that normally somebody else would do. But for this, I especially went into medical journals to find very specific information about specific cases. I'd like to give a warning beforehand that there will be pictures of the self-surgeries. Some of these are a little bit gory, so if somebody has issues with that, I'd like to let you know beforehand. There will also be a warning before images that actually have gore in them. So, two of the surgeries that I'll be talking about today are appendectomies. That's when you go in and you remove the appendix. It's usually a pretty simple procedure. You make a cut just about here, and you go in and you remove the appendix from the end of the intestine right there. It's pretty simple, but of course there will be more complications and more difficulties when you're doing it on yourself rather than on another person. Which contains gore. Okay, so this is Leonid Rogozov. He was a researcher in a Russian research station in Antarctica. He was the only doctor of the 13 researchers that were up there when he developed acute appendicitis. There were no doctors there, and this was in 1961, so there was no way for somebody to get there in time or for him to get to a hospital in time for them to remove his appendix, so he had to do this on himself. What he did was he had the other researchers help him set up a surgery table, and he laid himself down on it and he cut away at himself. According to the case study of the surgery by Neil Bermel of Sheffield University, the visibility and the depth of the wound was not ideal. Sometimes he had to raise his head or use a mirror to look in, but mostly he worked by feel. So that means he wasn't even looking at his appendix or his intestines. He was feeling around for all the organ that he needed to remove, which is pretty hardcore. Yeah, he did that all himself and none of the other people could help him because none of them knew anything about human anatomy or anything like that. So they stood around, sometimes they handed him implements, but he was doing the entire surgery himself. The next one is Evan O'Neill Kane, and this one isn't gory because it's from the side, but this is him performing the surgery on himself. He actually did multiple surgeries on himself. The first one that he did was an amputation of his finger. I couldn't find very much information about that, and I don't know why he amputated his finger, but that's the thing that he did. And this one is the appendectomy, which he did not because of any dire need. He was in a hospital, there were plenty of other doctors around, and he had chronic appendicitis, which means that it wasn't an emergency, they had to have it removed. But he did it anyway, and the reason that he did it, according to the case study by Rennie Chalmers, MD, is that he performed the surgery to demonstrate the safety of local anesthesia for a major operation and the safety of appendectomies. So, his brother was there, and his brother also helped him close up the wound afterwards, and his brother watched it, and apparently he was smiling through the entire procedure. So, I don't know what was wrong with him, but I think that's pretty rad. And he was 60 years old when he did the appendectomy, and then he was 71 when he did another procedure, which was a surgery on an inguinal hernia. An inguinal hernia is about here in the groin area, and it's especially dangerous to operate in that area because of the femoral artery, which is a very large artery that runs down the thigh, and it's very large, and if you nick it, then you could cause almost instant death to the patient. And he was performing on this himself, which is incredibly dangerous, but the whole time through he was laughing and joking with the people who were like handing him the scalpels and stuff. And he survived. Like, he did the surgery incredibly well, and he was fine. Which, like, I don't know how he did that, but he did it, and that's pretty amazing. But the appendectomy was the most famous surgery of his. It was the only one that they got a photograph of. Yeah, and that was pretty much what made the public be okay with anesthesia and the like, because people were pretty sketchy about local anesthesia. Local anesthesia is when only a certain part of the body goes numb while the rest of you is still fine. So like, say you were getting surgery on your leg, then they could just give you local anesthesia in your leg and you would be awake while the doctor was operating on your leg. And most people are pretty freaked out by that, but some people would prefer to see the doctor operating on their leg. I don't know why. And this is Inez Ramirez. The image contains gore, so. Okay, so this woman, I think this is my favorite of the three that I'm showing you today because she's not a doctor. She has no medical training at all, and what she did was a C-section on herself with no anesthesia. So, and does everyone know what a C-section is?
Yeah.
Good. Okay, cool. So that there's the son that she delivered via C-section. So she had been pregnant before, and the pregnancy had ended in fetal death because of an obstruction while giving birth. And this time she was alone in her home when she began to go into labor. And she was in labor for 12 hours, which is a dangerous amount of time for anyone who doesn't know, before she decided that she had to do something to make sure that her child survived. And so what she did was she took 3 shots of hard alcohol. She took a 15-centimeter knife and she just cut herself open. And it took about an hour for her to be completely done opening her abdomen to remove the child. But she finished and she took out the child and she cut the umbilical cord with a pair of scissors and then she passed out, of course. And her son, she had other children, 7 children to be exact. And most of her children were out working with other things, but her son came back and found her and called somebody from the local clinic, and the clinic didn't have the means to care for her, but they sewed her up with regular sewing needle and thread, which was the best that they could do at the time, and then they took her to a hospital, which was over 8 hours away. And she survived. I mean, the doctors, all they had to really do was clean her up a little bit. She made a little bit of she made a little injury on her intestines, but mostly she did it very well. She didn't hurt herself or the child, and she and the child are still alive and well today, actually. And she said that the reason that she was able to do this, despite having no medical training, was her practice in slaughtering animals. Because she lives in a very rural area, so she had to take care of animals, and she has practice cutting them open, like removing the guts and the like, so that they're ready to eat. And that saved the life of her and her baby. And as you can see here, this is the entire cut that she made. I'm not exactly sure, but I'm pretty sure that's the regular sewing needle and thread that showed her up, because that doesn't look professional. But yeah. And over here, that's her son, and that's the knife that she used to cut herself open to get the baby out. And according to the International Journal of Gynecology and Obstetrics, surgery was performed only to repair the damage to the intestines and to sew her up. And other than that, she was perfectly fine. So, self-surgery is incredibly rare and incredibly risky, and I highly recommend that you don't try it. Don't try it, okay? But the next time that you're at the dentist and they're pulling out your tooth or something, maybe you can thank them for doing that for you instead of letting you do it yourself.